Hi, my name is Charlene.
And my name is Young Young.
We are final year speech pathology students from the University of Sydney. Today we'll be discussing stuttering and its treatment in school-aged children. To begin, we'd like to acknowledge the tradition of custodianship and law of the country on which the University of Sydney campuses stand. We pay our respects to those who have cared and continue to care for our country.
Today, we will begin by providing an introduction to stuttering and the different stuttering behaviors. Then we'll discuss the LITCOM program and the Westmead program as the treatment options for school-aged children. Then we'll conclude by discussing the importance of early identification and intervention and outline strategies to support children with stuttering.
Stuttering is a motor speech disorder. It's characterized by involuntary behaviors that impact the smoothness of a person's talking. Stuttering usually starts between 3 and 4 years of age. While there is no known cause of stuttering, it may be due to family history or a difference in brain activity. Approximately 1 in 100 Australians stutter. There are different behaviors when someone stutters. Sound repetitions. Let's read this book. Syllable repetitions. We were going. Whole word repetitions. But I like that one. Phrase repetitions. And then we played. Sound prolongations. I like swimming. And blocks, when there is a pause in speech, such as we ate a cookie. There are also non-verbal behaviors, such as eye blinking and facial grimacing. Feelings can also affect stuttering. Feelings of anxiety, stress, or exhaustion can increase stuttering. The same goes for excitement and being rushed. This can also increase stuttering. Some children are naturally excitable, which may impact the flow of their speech. Yong will demonstrate what this looks like.
I want to go to the park and get ice cream. And I want to get the chocolate flavored ice cream because that's my favorite ice cream.
As you can see, the inhalations and word repetitions that an excited child demonstrates might seem like a stuttering behavior, but they're not. However, when in doubt, refer the child to a speech pathologist for further assessment. We all have moments where we don't speak smoothly. These are called disfluencies. When someone does not understand what is going on, they might take time to process and understand what's happening. This might look like a block, but this processing time is not a stuttering behavior. Examples of disfluencies include adding filler words. I wanted the sandwich. Revisions, which is changing the words in a sentence. Word finding difficulties and not finishing a thought. However, these disfluencies are different to the stuttering behaviors described earlier.
There are different treatments for stuttering. One such example is the LITCOM program, which is a behavioral treatment that is typically administered to children who are younger than 6 years old. In some cases, however, it can be suitable for older children. Typically, the people involved in the treatment include the child, the parent, who will be expected to deliver treatment at home, and the clinician, who will be expected to train the parent in delivering the treatment. That being said, there are hybridized versions of the LITCOM program which involve teachers delivering the treatment at school. Regardless of who delivers the treatment, they will be trained to use different features of the treatment by a clinician. These features involve commenting directly about the child's speech, generally in a positive manner. This means that comments are made primarily when the child speaks without stuttering and only occasionally when the child stutters. These comments are termed verbal contingencies as shown on the slide. During stutter-free speech, the parent or teacher may use praise, request self-evaluation, acknowledge when giving praises. This might be, I like your smooth talking. For requesting self-evaluation, it might be asking, was that smooth? And for acknowledgement, it might sound like, that was smooth. During moments in which the child stutters, the parent or teacher may acknowledge, "That was bumpy," or request self-evaluation. "Do you think that sounded bumpy?" Other examples of each verbal contingency are presented on this slide. The majority of treatment is administered in the child's everyday environment. This can be at home or at school. Clinicians train parents or teachers to deliver the verbal contingencies by first demonstrating how to use them, then observing parents or teachers use the verbal contingencies with the child before providing feedback. This training occurs in clinical sessions with the clinician. For parents, they're expected to attend weekly sessions with a duration of 45 to 60 minutes, though later on, these session times may cut down to 30 minutes per week. To allow those who deliver the treatment the ability to measure a stutter, they are trained by a clinician to use a severity scale that indicates how severe a child's stutter is. This scale is depicted here. For example, 0 is no stuttering, 1 is extremely mild stuttering, and 8 is extremely severe stuttering. As the scale progresses from 0 to 8, a child's stutter becomes increasingly more noticeable. At a severity rating of 8, a child's stutter is so severe that the message they are trying to convey in their speech is not communicated at all. During the Lidcombe program, the child's stutter will be rated daily by the parent. In hybridized versions of this program, teachers may not be able to rate the child's stutter daily, but it is expected that it will be done so in a regular manner. In both cases, however, the clinician will check that these ratings are correct during calibrations conducted in sessions with the clinician. This involves their ratings being compared to a clinician's rating of a speech sample collected from the child with a stutter. To be a valid rating, the parent or teacher's rating needs to be the same or within one score of the clinician's. The Lidcombe program consists of 2 stages. The first stage aims to achieve stutter-free speech in daily conversation. The second stage aims to keep stuttering from returning. As evidence shows that relapse after successful Lidcombe program treatment can occur, this goal is particularly important. This stage will also involve handing over complete responsibility for management of the child's stutter to their parents and/or teachers. Eventually, the use of feedback from the clinician will reduce, as will the number of sessions with the clinician. To progress to the second stage, the following 2 criteria need to be met for 3 consecutive clinic visits, 1 week apart. 1. Parent severity ratings of 0 to 1 during the week preceding the clinic visit, with at least 4 of those 7 severity ratings being 0. 2. Clinician severity ratings of 0 to 1 during the clinic visit. A minimal requirement during stage 2 is for parents to record severity ratings only during the week preceding the clinic visit. However, the clinician may direct parents to record severity ratings more often during stage 2. The Lidcombe program is strongly evidence-based. Numerous articles indicate that the Lidcombe program is effective at eliminating stuttering in young children and at reducing stuttering behaviors in older children. The treatment can also fit well in people's daily schedules, as treatment can take as little as 10 to 15 minutes to administer each day. This program also employs a strength-based approach, focusing on the child's strengths by commenting on their stutter-free moments, as opposed to their weakness, unambiguous stuttering. However, there are disadvantages. For those who will deliver this program, it's a long-term commitment. It involves daily treatment, weekly visits over many months or even years. For many, cost is also deterrence. Requiring a specially trained clinician is very expensive, and sessions can range in the hundreds.
Now on to the next treatment available for young children. The Westmead program is a treatment for young children which involves syllable timed speech. Syllable timed speech refers to saying each syllable with equal stress in time to a rhythmic beat. That's why the Westmead program is also known as robot talking. For example, rather than saying the kitten is licking its paws, robot talking would sound a bit like the kitten is licking its paws. The goal of the Westmead program is to reduce the robotic nature of syllable time speech to make it sound natural. At the beginning of the Westmead program, the clinician teaches the parent and child how to do syllable time speech through demonstration, imitation, and practice. Initially, syllable time speech is taught using a slowed speech rate. Then, over time, it progresses to a near normal speech rate, with normal intonation, volume, and pitch. Syllable time speech techniques have been used in different forms for hundreds of years, for example with a metronome. Research shows that variations in syllable stress may trigger stuttering, so saying each syllable in words to a rhythmic beat reduces these variations and supports the child to produce stutter-free speech. The aim of Stage 1 of the Westmead program is for the child to speak with no stuttering or almost no stuttering in everyday conversations. Parents are encouraged to conduct 5 to 10 minutes syllable time speech practice sessions with the child 4 to 6 times per day. The severity rating scale is also used to measure a child's stuttering in progress, with the parent and clinician meeting weekly to discuss treatment and compare severity rating scores. In order to progress to Stage 2, the clinician rates the child's severity rating 0 to 1 during a consultation and daily parental severity rating scale. The severity rating scale is also used to measure a child's stuttering in progress, with the parent and clinician meeting weekly to discuss treatment and comparing severity rating scores. In order to progress to Stage 2, the clinician rates a child's severity rating 0 or 1 during a consultation, and daily parental severity ratings have to be 0 to 1 at least 4 out of 7 times a week before the consultation. These criteria need to be met for 2 consecutive fortnightly consultations. In Stage 2 of the Westmead program, the aim is for no stuttering or almost no stuttering to be sustained for a long time. The parent slowly withdraws practice sessions, and decisions about withdrawal of practice sessions are based on the child's severity ratings and clinician discussion with the parent. Stage 2 is also about empowering parents to problem solve and deal with any increases in stuttering. If stuttering increases minimally to severity ratings of 0 or 1, the parent is taught to reintroduce a practice session daily until the severity ratings are 0 to 1 again. While the evidence base for the Westmead program is not as extensive as the Lidcombe program, evidence shows that it decreases stuttering in school-aged children. While the evidence base for the Westmead program is not as extensive as the Lidcombe program, evidence shows that it decreases stuttering in preschool and school-aged children. The positive elements of the Westmead program are that it's straightforward, no resources are required, and stutter-free speech occurs if administered properly. However, children may not like talking in syllable time speech. There are large amounts of daily practice required, and that's a significant commitment from parents. It also requires the parent or carer to administer treatment.
So far, we've discussed 2 evidence-based treatments, the Lidcombe program and the Westmead program. However, according to evidence, early identification of stuttering and early intervention is key. The reason why this is the case is because children younger than 5 years old have more neuroplasticity, meaning that compensatory changes to the brain can still occur. Missing this age bracket increases the risk of stuttering persisting into adulthood, as it becomes increasingly more difficult to rewire persisting behaviors. Negative behaviors are also associated with stutters that are not addressed. Research shows that people with persisting stutters into adulthood can experience poor psychological, educational, occupational, and social outcomes. As children who stutter often experience reduced self-confidence that affects their participation in school when they are required to read or talk aloud in class. A teacher's role is important. After the child's parents, teachers may be the next responders who help identify stuttering early, which can then allow for early identification and hopefully the prevention of such negative outcomes. If there is a child in a classroom who stutters, teachers may use the following general strategies to support their participation at school. Be patient and allow time for them to speak. Wait a few seconds after the child finishes before speaking. This sets a slower pace that can reduce the anxiety or stress of a situation. Repeat and paraphrase what the child has said. This is especially relevant for children who present with severe stutters. Often children can express frustration at not being understood. Repeating or using different words to let the child know what they have said is understood can facilitate better communication exchanges. Don't ask the child to take a deep breath, calm down, or think before you speak. This kind of advice can actually increase their anxiety and make their stuttering worse. Don't react negatively when a child stutters. This is important as others' reactions can often cause the child to perceive themselves in a negative light and affect their self-esteem. Don't pretend that the child doesn't have a stutter. Make sure that the child is receiving adequate help, as again we know from research that early identification and intervention is key to supporting their outcomes into adulthood. If you would like some more information about stuttering and how to support students with stuttering, please visit the following resources. We hope this presentation has shed some light about stuttering and its treatment in school-aged children. In summary, stuttering impacts the smoothness of someone's talking, and there are different stuttering behaviors that exist. The LITCM program and Westmead program are treatment options for young children and school-aged children. Early identification and intervention is crucial for children who stutter, and teachers may play a role in supporting children who stutter with general strategies or being asked to participate in treatment. Thanks for listening.